Next, we will move on to the restrictive lung diseases. So, restrictive lung diseases in the sense there is going to be restriction to the expansion of the lung. The lung is not able to expand because there is some fibrosis kind of thing which is restricting the movement of the lung. So, we have two major diseases under this. So, first will be the fibrosing lung diseases and next will be pneumoconiosis. So, starting with fibrosing lung diseases, we have three types of fibrosing lung diseases basically. So, the first one will be usual interstitial pneumonia, which is also called as idiopathic pulmonary fibrosis. Here, the location is going to be patchy kind of a distribution. The fibrosis is going to be patchy and the usual location is going to be in the subpleural location. While the non-specific interstitial pneumonia, it is going to be a diffuse kind of process. The third one, which is cryptogenic organizing pneumonia, it is going to be associated with formation of Mason bodies. These are nothing but fibrotic bodies only. So, these fibrosis is seen around the bronchioles. So, organized fibrosis is going to be seen around the bronchioles. Okay, so this is the bronchus. So, around this, we are going to see this fibrosis. These are called as Mason's bodies. Next, we'll see about the next type of restrictive lung diseases, which is pneumoconiosis. Pneumoconiosis are usually occupational diseases. Occupational exposure to certain mineral dusts or certain substances is going to cause fibrosis. And these particles are usually of the size of 1 to 5 microns. So, only these size particles can go deep into the bronchus, bronchiole and reach up to the alveoli and cause this fibrosing lung diseases. Okay, so this size is very important. So, let's see about the major types of pneumoconiosis, starting with silicosis. So, silicosis is the most common type of pneumoconiosis, and here the most common form of silica which is going to cause this pneumoconiosis will be a quartz type. Okay, quartz silica is going to cause silicosis, and here all of the pneumoconiosis is again going to involve the upper lobe, except that of the asbestosis, which is going to involve the lower lobe. Okay, so rest all it is going to be upper lobe. And what is the feature which we see in silicosis? You get massive amounts of collagen which forms whorls and forms nodule kind of appearance. So, nodular fibrotic areas are seen in the lung formed because of this whorls of collagen as a reaction to this silica. And silicosis has an increased risk of tuberculosis and cancer. Okay, and the classical feature which we see on X-ray will be on the hilar lymph nodes. There will be a feature called as eggshell calcification. Okay, other than that, next we'll see about the coal workers pneumoconiosis. So, people who are working in coal mines are susceptible for developing this kind of pneumoconiosis. And here it has three phases. The initial phase will be an anthracosis phase, which is just a black lung. The lungs entirely will become black because coal is going to be black in color. So, because of inhalation of this coal particles, the lung will appear black and the patients will be asymptomatic. Next stage will be the formation of the coal macules. That is the stage of simple coal workers pneumoconiosis. So, in simple coal workers pneumoconiosis, we are going to have the formation of coal macules. These are nothing but alveolar macrophages only, which have taken up this coal particles. So, they are going to appear as black in color. And as I mentioned, it is going to be common in the upper lobe again. The third stage will be progressive massive fibrosis, wherein this coal particles is going to trigger the fibrotic lung reaction. So, it is going to form collagenous scars which were produced by the fibroblasts. So, that stage is the one which is going to be called as progressive massive fibrosis. So, third type of pneumoconiosis will be asbestosis. So, asbestosis can be caused by various kind of asbestos fibers. So, most common of which will be the amphibole fibers, which is the most dangerous one also. While the other form of asbestos fiber will be serpentine fibers or chrysotile fibers. So, even if the patient has a exposure to asbestos for 5 to 10 years, so even after exposure ceases, even then the patient can have a risk of developing asbestosis. Okay. That is, it can progress even without the stimulus being continuously present. And the most common presentation of this asbestosis will be formation of pleural plaques. So, this is the most common and the earliest feature also. But here the asbestos bodies will not be formed. The next stage, which is the formation of pleural nodules or fibrosis. So, the pleura between the visceral pleura and the parietal pleura, there will be fibrosis. So, the entire pleural cavity is going to be obliterated. So, when the pleural cavity is obliterated by fibrosis, asbestosis, the lungs cannot expand properly, right? So this is the second stage, which is called as pleural fibrosis, and here it can be associated with asbestos body, which is also called as ferruginous body. So these bodies have a classical dumbbell kind of shape appearance. So what inside in the center you have this asbestos fiber, surrounding which you have various minerals. So the most common mineral which deposits around this asbestos will be iron. So other than that, we can also have magnesium and other types. So it is not specific for asbestosis, but called as a dumbbell shaped kind of a asbestos body. Since iron is being coating this asbestos fibers, it can be stained by the Pearl's Prussian blue reaction. So that is one of the questions which can be asked. So what are the cancers which can be associated with asbestosis? Like silicosis, this also has an increased risk of cancer. The most common of commonest one will be the lung adenocarcinoma rather than mesothelioma. Even though it causes mesothelioma as well, mesothelioma is a very specific kind of cancer for asbestosis, but lung adenocarcinoma is the most common kind of cancer associated with asbestos exposure. Other cancers related with asbestosis will be laryngeal, stomach or kidney cancers or colon cancers also. So let's see about the various other types of mineral particles which can cause which can also cause pneumoconiosis. So starting with siderosis. So as the name suggests, siderosis means iron, something related to iron, right? So iron oxide particles can result in siderosis. Tin oxide can cause thanosis. Cotton dust can cause byssinosis. Sugarcane dust can cause bagosis. Barium particles can cause barytosis, while beryllium can cause berylliosis. Berylliosis can also result in cancer formation. And there is Kaplan syndrome. So Kaplan syndrome is nothing but a combination of this pneumoconiosis with rheumatoid arthritis. Okay, and most commonly the pneumoconiosis which is associated with Kaplan syndrome will be coal workers pneumoconiosis. Okay.